Welcome to The Advocates. I'm Aaron Dean. Idaho is asking the Supreme Court to allow its state abortion ban to go into effect despite a legal challenge from the Justice Department. Idaho's Defense of Life Act automatically went into effect after the Supreme Court ruling to overturn Roe v. Wade. The law is a near total ban on abortion unless it's used to prevent a mother's death. The law also imposes penalties on doctors that perform abortions. In 2022, a district court blocked the law in hospital emergency rooms that receive Medicare funding, saying that state law interferes with a federal law. After back and forth in appeals, that ruling was reinstated on November 13th. A similar case is pending in Texas. Vice President Harris is calling for gun control, mental health, and abortion rights. The Vice President is on a tour to reach out to voters ahead of 2024. She recently spoke at an event in Houston hosted by the Congressional Hispanic Caucus about the importance of bodily autonomy and reproductive rights.
The highest court in our land, the court of Thurgood and RBG, took a constitutional right that had been recognized from the people of America, from the women of America. And thereafter, in states across our country, including here, extremist so-called leaders passed laws to criminalize healthcare providers. Here in Texas, it's my understanding that literally the law provides for a life term in prison for a healthcare provider, laws to punish women for simply exercising bodily autonomy, the right that all people should have to make decisions about their own body. Laws being passed with no exceptions even for rape or incest.
14 states, including Texas, have made abortion illegal since the overturning of Roe v. Wade. 10 states have expanded access. The American Heart Association is working to understand health disparities trans people face on a daily basis. A new study finds that trans adults in rural America have a higher risk of heart disease. Dr. Streed Jr. says that we can bridge the gap in healthcare. Dr. Streed, thank you so much for joining us. How are you today?
I'm doing great. Thanks for having me.
Yes, of course. Can you discuss some of the key findings of the new research on cardiovascular health among trans adults in rural America?
Some of the key findings from this small study in rural America is that trans people are still experiencing worse outcomes with regards to cardiovascular health, and particularly with regards to certain risk factors, such as excess weight, which we have seen is associated with certain cardiovascular outcomes, as well as issues around tobacco use and the like. This really kind of gives us an idea of what may be happening in a small community for trans folks in rural America. The issue that we're hoping we can see with future research is that we get a better idea of what's happening in all parts of the country in terms of other rural communities, not just the one that's presented in this study. But this study is really a good step forward for us to understand what's happening outside of the urban centers that I think we stereotypically focus on when it comes to broadly LGBTQ health.
And how might the combination of gender identity and rural living contribute to, disparities?
There's so many things we could talk about with regards to that. I think even when you just look at the difference between access to care in urban versus rural settings, there's a stark divide in terms of being able to even find a clinician who is welcoming, being able to find a clinician who's even had training to be able to address things related to gender affirming care, or at minimum, just feeling comfortable taking care of trans individuals. Because currently, we still do not have a requirement for physicians to have training around gender affirming care, or to at least have some exposure to issues around gender affirming care. So that's a big issue with regards to the divide between urban and rural healthcare access. But then we also see issues around cardiovascular health. If you are in communities that are not particularly welcoming, you might not actually want to engage in, for example, outdoor physical activity because you may be fearful for your safety. There may be issues around not being able to find community in general. So you may have issues around isolation and loneliness, which we've actually seen is as bad as smoking for some communities. And I think that's something we see reflected in this study. There's many other components of this study that we could talk about, but what it really shows is that there's this intersection of being trans in the current American context and being trans in a rural setting having pretty much deleterious effects for people's health.
In what ways could healthcare professionals and public health initiatives address these risks identified in the transgender population, particularly in these rural settings? What more can be done?
So I feel like every intervention we have tends to be a little bit more of like a one size fits all, when we know that doesn't really work well for folks. In the context, for example, of tobacco cessation or trying to help people to quit smoking, when we have programs that really acknowledge people's identities, really talk to them about the unique triggers that may be supporting their smoking habits, they actually have a better quit rate. This is actually research that was done in Chicago specifically for lesbian and sexual minority women. If we had similar interventions for trans folks, particularly in rural settings, we'd probably see better issues with regards to tobacco use. Same when it comes to engaging in physical activity that is good for your heart and for your brain. If we had interventions that were essentially acknowledging people's identity, building community around that, they would probably be able to safely engage in the physical activity that we recommend. This is what public health officials need to recognize, and this is what clinicians really need to recognize, is that when we support and affirm people's identities, they're actually able to actively engage in essentially better coping mechanisms and engage in behavior that's good for their health.
And you've mentioned the impact of mental stress faced by the LGBTQ plus community in rural America. Now, how can communities work together to address the needs of these individuals, considering, like you said, the unique challenges that they may face in these settings?
I mean, first things first is actually truly be welcoming. Stop saying your community is welcoming when in fact people are definitely being ostracized based on their identities. What really needs to happen is that people are affirming and really engaging every member of the community, making sure that nobody feels isolated or particularly singled out, as it were. Additionally, these communities can really make sure that they are carving out opportunities for people to meet other people of shared identities. And even when that's not possible, making sure that they are connected to essentially the heart of the community, which can be through a number of community organizations, can be through religious and faith organizations, can be through school and work and so forth. These communities, all communities, really need to recognize that they have to be as welcoming as possible.
And the study acknowledges the limitations in its small sample size. What steps do you recommend for future research to enhance our understanding of cardiovascular health in transgender individuals?
So there's a number of initiatives that I and others have really been pushing for, and these researchers really also highlight, is that we need to use existing data in all parts of the country at this point. And that means utilizing insurance claims data, using electronic health records in all settings, not just city settings or urban centers, but also really looking at the experience of clinical care in rural settings. Additionally, all future research that looks at cardiovascular health, or arguably all future research, really needs to collect appropriate data around gender identity. We can't keep using binary categories of male versus female. We really need to include questions around sex assigned at birth, gender identity, gender expression, as well as medical and surgical interventions as it relates to those factors. Only then can we really paint a more complete picture of what is to be expected for a particular community's cardiovascular health.
As we know, we're in a time where healthcare for trans people, it's under attack. So how does the banning or restricting of this kind of care hurt trans people who are depending on it?
So there's the direct harm. So you've essentially cut people off from healthcare that has essentially been proven to help them, both in terms of their mental health as well as components of their physical health. Gender affirming care does save lives, and it improves people's ability to move from a mode of survival to actually thriving. But then there's the larger, more indirect impact of essentially a community saying you are not welcome, or we do not believe in supporting you. And that really gets under our skin through a process that we describe as minority stress. And we've definitely seen this very well characterized for racial and ethnic marginalized populations. We've seen this characterized for women. We are now really having more research show that this does happen for broadly sexual and gender minority folks, and in particular trans individuals. That when a community or when there's messages saying that you are not welcome, that causes issues around increased anxiety, depression, suicidality. But then it also affects a number of parameters around cardiovascular health, including people's heart rate, increased levels of cortisol, and then downstream effects around hypertension, diabetes, and the like. So these policies are causing direct harm to people's mental and physical well-being.
Thanks so much for watching The Advocates. Download the app in the Apple or Google Play Store to stream us live, and you can even subscribe to our YouTube channel. For The Advocate channel, I'm Aaron Dean.